Hi, my name is Robin McCommons, and today I'm going to use the critical incident analysis strategy to examine the role of nursing leaders in employee engagement at the unit level. After today's session, the nursing leader will be able to identify two behaviors of an engaged and an unengaged employee. Secondly, explain how the level of employee engagement can impact patient outcomes. And thirdly, identify two steps they can take to improve employee engagement. There are many definitions of employee engagement, but in general, it is the level of involvement and dedication an employee feels towards their organization. So let's look at employee engagement at the unit level. I'm going to share with you a critical incident of a nursing supervisor. He used a critical incident analysis questionnaire to help him reflect on the situation. First question on the questionnaire is to describe the incident. The nursing supervisor wanted to reduce the number of patients that were experiencing post-op nausea and vomiting in the recovery room. First thing he did was develop a multidisciplinary team that included several frontline staff nurses. The team implemented an evidence-based protocol to reduce the number of occurrences. The team met frequently to discuss what was working well and where they had opportunities for improvement. The nursing supervisor also had daily huddles with the staff to listen to their feedback, answer questions, and provide support. After 2 months, the occurrence rate of post-op nausea and vomiting decreased by 20%. The next question, why was the incident critical or significant to you? It was critical to the nursing supervisor because they improved patient outcomes and he led a team to success. Next question, describe your response to the incident. He was doubtful at first that they would make much of an impact, but when he saw the results, he felt like anything was possible if you have the right team members involved. Describe how the other individuals involved responded. The other individuals didn't think it was possible, but quickly changed their minds after seeing the results. What were the outcomes of the incident? The most important outcome was a reduction in post-op nausea and vomiting. Some patients experienced their first surgery without having nausea and vomiting, and they were amazed. Staff felt ownership because every nurse played a role in making this happen. They were excited about the impact they were having on patients. The nursing supervisor felt a sense of accomplishment to be able to make such a change for the better. And the last question, explain how it impacted you. What did you learn? The nursing supervisor, through this experience, realized the power of combining a multidisciplinary team and involving key stakeholders when implementing a process change. He learned that it's more of an accomplishment facilitating change rather than attempting to do it without help. In the future, he plans to always engage staff with any decisions regarding change because it truly makes a difference with the acceptance of change and their personal satisfaction. Now I'm going to share another critical incident with that same nursing supervisor. Describe the incident. He was tasked with implementing a new anesthesia protocol. He did very little preparation or education with the staff. He rolled it out and went on vacation. How was the incident critical to you? He felt it was critical to him because he was not very successful. Describe your response to the incident. He felt bad because the staff were confused and frustrated about the new process. They did not support it, and they had lots of valid points. Describe how the other individuals responded. The staff were very resistant and uncomfortable with the new process. They were not happy. What were the outcomes of the incident? The outcomes were frustrated staff that felt like they were being forced to do something that they didn't have enough information about. Explain how it impacted you. What did you learn? He learned that he should plan ahead and not rush when implementing change. He learned how difficult it is to implement change without involving staff, providing education, and being there to support them. So let's review what we've learned about employee engagement. Engaged employees are involved with what's going on the unit. They're less stressed when they're faced with change. Engaged employees are supportive of change and feel driven and empowered to face challenges. On the other hand, unengaged employees are not involved and feel stressed when faced with change. They feel like things are being forced on them, and consequently they feel powerless, unmotivated, and are resistant to change. The level of employee engagement can impact patient outcomes. Engaged employees have buy-in to initiatives, and they feel a sense of ownership. This causes them to put in that extra effort to meet the unit's needs. Lastly, engaged employees are satisfied employees, and that's key to achieving patient satisfaction. So let's review steps you can take to get your employees more engaged. You can provide timely and accurate information. Empower your staff and let them be part of the decision-making process. Participate in what's going on in the unit. Support your staff. Provide an avenue your staff can provide feedback on change initiatives or day-to-day activities. Lastly, make sure you provide the education and training your staff need to perform their jobs. Thank you for your time today. Hopefully this will help you understand your role as a nursing leader in getting your employees more engaged.